So I think finally, after much technical difficulties, we may well be live. I'm just going to pop on and see whether anybody is with us today, and then we will introduce ourselves. Welcome if you can see us. Let's have a look. Oh, I think we are live. How lovely. Right, I'm just going to get rid of a few little pop-ups on the screen, and then we're going to make a start and introduce ourselves. My name's Emma Rigby. I'm the matron for the Maternity Outpatients at Oxford University Hospitals, NHS Trust. And my team includes the general outpatients here at the John Radcliffe and also at the Horton, and also the Fetal and Maternal Medicine Department at the John Radcliffe, and also we run some clinics at the Horton. So that's a little bit about me. I'm going to introduce you to the team now. So I'm going to introduce you to Jane Membry, our clinic sister.
Good afternoon. So I cover the antenatal clinic, general clinic at the John Radcliffe and also at the Horton Maternity Unit, and manage the maternity assessment, midwife assessment clinic in the Horton Hospital as well.
Thank you. Susan?
My name's Sue O'Sullivan. I'm one of the team of maternity support workers. So much like Jane, I work across both sites, but the majority of the time is at the Horton in antenatal clinics and diabetes clinics too.
And Kate?
Hello, I'm Kate Jones. I work within fetal medicine mainly, but it's within the main department of fetal maternal medicine, and I also work within the day assessment unit here at John Radcliffe.
Fantastic, thank you so much. So I'd like to welcome the 27 people that are watching us today. And I'm just going to give a little list of information. So we wanted to run through some information that you may find valuable when coming to the outpatient departments here in maternity. And we wanted to run through a little bit more detail about the actual departments and what to expect and what to see. So Jane's just going to explain a little bit more about the general outpatients departments here at the John Radcliffe and at the Horton. And we'll all go through the different departments, and then we'll have opportunity for questions. But do please pop your questions up on the screen at any time you want. So Jane, over to you.
Thank you. So if you were requested to see a consultant in your pregnancy, usually your community midwife would make a referral to the hospital for one of the consultants to then make an appointment to see you. So that would be done soon after you have your initial booking, around 10 weeks of your pregnancy. And once we receive that referral, it may come from your midwife, it may come from your GP. That is then looked at by your consultant that's allocated to you. We have a team of 8 consultants that I work alongside, and they would look at your referral, and one of those consultants would then arrange to see you. That appointment may be face-to-face or it may be over the telephone, and it's usually following either your nuptial scan or following your anomaly scan, so that we have more information on your pregnancy before we then see you. After the doctors have looked at the reason for the referral, you should receive notification of an appointment through the post, and that will give you more information about where your appointment is and when. When we see you in the hospital, we'll go into more detail about the actual appointments that we offer. But we see 8 consultant clinics, or I manage 8 consultant clinics a week. The appointment that you get, you will be invited in, and you may or may not then be invited back to see the consultant again, depending on the reason for your referral. I don't know how much more detail you want me to go into.
That's a perfect amount of detail, thank you. And I think, Kate, if you could just talk a little bit about the fetal and maternal medicine team, thank you.
Yeah, so fetal and maternal medicine receive referrals directly from community midwives, GPs, within fetal medicine from the ultrasound departments both here and at Horton. We also receive wider referrals, we act as a tertiary referral centre for the network that we work within. So at the hospitals within the area that we work, they refer in for extra or second opinions from our team. In terms of the referral, that gets processed by the midwives, but also the consultants that work within fetal medicine. And once we have a response, either from the consultants or from the through triage, we will then contact the patient and invite them in for an appointment. Very much depends on the type of referral that we receive as to when we tend to see our patients, but we don't tend to see anybody until after the 12-week scan, so the nuchal scan.
Thank you. Thank you. The other departments within the fetal and maternal medicine team are, Kate's obviously works within the fetal medicine department. We have the maternal medicine department, so women with higher risk pregnancies with some medical complications, maybe such as diabetes, may be seen through our maternal medicine department, and they might be through the specialist diabetes team or through our maternal medicine team, which is also known as the Silver Star team. And we're really lucky to have Sue with us. Do you want to explain a little bit, Sue, about your role and also the clinic that you run?
Certainly. So I see most women as they come through to the antenatal clinic. So ordinarily you would check in at reception, provide evidence of your negative natural flow test. You would then come through and I would collect your blue notes, and then I take each woman one at a time, obviously, and I dip their urine, I do their blood pressure, and we'll do their weight. Document that, make sure that they're okay, have any brief questions. My notes I then give back to the midwife who checks any blood results. So I will see everyone. So I tend to see women quite regularly when you come through to the clinic. I am the face of it. Exactly.
The lovely face.
You organise it.
And Sue, you also run your own clinic, don't you?
Yes, so on a Monday from the Horton we run a lifestyle clinic, and this was set up with midwives, and Emma Rigby set it up in 2017. So all ladies that live under the umbrella of the Banbury midwives with a BMI of over 35, they're referred in. And the aim of the clinic is to help manage a healthy weight gain in pregnancy. So it's just to put pointers in for any diet or exercise that we can change to help you manage a nice steady weight gain in pregnancy. And we offer between 3 and 4 appointments to these women. We arrange the glucose tolerance tests and just help with that extra time of patience of doing the lifestyle clinic.
That's lovely. And some of the stuff that Sue does in lifestyle is also mirrored across the trust in different formats, but certainly that the lifestyle signposting and health information is offered by the teams, by the community teams as well. So we've got some people, we've got Hannah watching, Melissa watching and Pat watching, so hello, welcome. So if you do have any questions that you'd like to ask the team, please do type them up and I'll read them out and we'll try and give the best answers that we can. We thought while we're waiting for some questions to come in, we might give a little bit of extra information about some of the other clinics that happen within the trust as outpatients. And if I start with the midwife assessment clinic, Jane, do you want to talk about that?
Yes, so the midwife assessment clinic in Banbury is open Monday to Friday, 8 till 4 p.m. every day, and it's run by a midwife and a support worker, an MSW like Sue, or even Sue works there as well. We offer a glucose tolerance test service Monday to Friday, so we usually see 4 women each day for that test, which some of you may have already had or be booked in for. And if you were to be, then your community midwife would give you more information what that test actually means. We also support the community midwives, particularly in Banbury and in Bicester, with additional blood tests. We do the nuchal screening blood test that you may need following your ultrasound in Banbury. And we also do some serum monitoring. So at 36 weeks, if you've not seen your community midwife, you may be signposted to come and see us, and we talk about testing you for the risk of carbon monoxide in your home, and we're looking at supporting you with smoking cessation and discussing the risk of smoking in your pregnancy. So lots of information, lots of advice giving. One particular topic that we're focusing on at the moment is colostrum harvesting, and we're giving out a lot of information on that. And we feel as a team that every time we see you, we want to be able to give you any additional information we can and support the community midwives in the advice that we can offer antenatally. We also see women that may be concerned whether the waters have gone, and probably the biggest admissions to MAC alongside the blood taking is that anybody with reduced fetal movements may contact us, and we would then either signpost you down to the John Radcliffe if you were likely to need a doctor's review, or in fact see you ourselves. And we have monitoring and equipment to be able to do that across sites to safely see you and review your pregnancy. We also offer cheap telephone triaging, so there's always a midwife at the end of the phone over that period of time, so if you wanted to ring up for any advice, hopefully we'll be able to offer that and support you with that as well. And we work closely with the midwives in the John Radcliffe as well for that.
Thank you, Jane. And we have a day assessment unit at the John Radcliffe. And Kate, do you want to run through about the day assessment unit?
Yeah, so the day assessment unit is located here on level 6 at the John Radcliffe within the Women's Centre. The day assessment unit acts as a place for women to come to where a doctor review might be needed to plan their ongoing care, but for additional input as well. So it might be that we perform repeat blood tests, and those results then reviewed with one of the team to make sure that the right plan is in place for these patients. The other thing that we see patients for within the day assessment unit is pharyngeal infusions, where patients have tried oral iron with sort of a good regime of taking that, and that hasn't been effective, say with severe anemia in their pregnancy and needing an additional infusion through a drip. We also see patients where they've got uncomplicated reduced fetal movements, so we've got monitoring equipment with us on the day assessment unit, and we're able to perform those CTGs to ensure fetal well-being. And then lots of other things in between. So yes, we act as a point of call within the hospital for higher risk and more sort of intricate care that's needed. Yeah.
That's great. And you can call, the phone numbers are on your blue notes, so if you do have any queries or questions that you think may fit within the day assessment unit, you can call there. But usually most of the appointments there are from a midwife or doctor referrals. So we've got our first question in, and this is from Louise. So we've now got Jane watching as well, but this is a question from Louise. When should I start colostrum harvesting, and how do I do it? And am I right in thinking I need syringes? And if so, where can I get them from? Who would like to answer that? It's Sue.
So we recommend from 37 weeks, am I correct? 37 weeks colostrum harvesting. So if you go onto the AUH website, you can download the leaflets on, there's 2 leaflets I believe. The first one is Colostrum Harvesting Pregnancy, which is almost an idiot's guide, but it's really, really good. It's just in black and white, so it's quite clear of how to do it. And it gives you lots of links on some videos to watch as well. There's also another leaflet that you'll have to download. It's after the best start. So from 37 weeks, start having a look at these leaflets. So the syringes, you can either get them from Amazon, some pharmacists sell them as well, or your community midwife team should be able to provide you with some.
Or if you come into the hospital, we can give them as well,
yes,
can't
absolutely.
we? Yeah.
Absolutely.
And the infant feeding teams are still doing their regular Facebook Live sessions, so they are also there to be able to give them further information about colostrum harvesting. But I'm hoping that does give you some information, Louise. Does anybody want to add anything on that?
No, it's usually something a community midwife would talk to you about when she starts discussing birth planning with you. And if you haven't had that conversation with her, then it is something that you could ask to have with her. Or equally, if you come to the hospital and you haven't a doctor's appointment, then just ask one of us, because we can equally go through it with you.
That's great, thank you. So if there are any watchers that would have like to ask any questions, then please do pop them up, and we'll do answer them the best that we can. It would be good just to speak about one of the other clinics that we run here, which is the Birth Choices Clinic. And the Birth Choices Clinic is a clinic that your community midwife or your doctor can refer you to, your obstetrician. And it's for women that want to discuss about sort of further things to do with their pregnancy and delivery. So maybe you want to discuss about caesarean sections, or if you've got certain plans that you want to talk through that may be more obstetric plans rather than what you would talk through with your midwife. And if you are interested in being seen at the Birth Choices Clinic and your midwife feels that it's a good place for you to have that appointment, they will certainly make that referral for you. And that Birth Choices Clinic happens here at John Radcliffe each week. It's a team of a consultant and also midwives that you'll be seen by.
Can I also say that when you have your consultant appointment at the hospital, it doesn't automatically mean that you will see the consultant at every appointment. So the consultant is usually present in the clinic, but there's usually 2 or 3 other doctors that may be working in the clinic at the same time. So the consultant will oversee your appointment and advise her colleagues if necessary. But they are still aware of the plan being made for you, but they may not actually directly see you yourself.
Thank you. And Louise has thankfully answered the question on colostrum harvesting, so that's great. Currently, with COVID restrictions, you may have seen some changes with the amount of people that can come into hospital with you, with birth partners, so during birth, but also when you're an inpatient at the hospital. But with outpatient appointments, we are still restricted to 1 birth partner coming in with you for all outpatient appointments and scans as well. And we do ask that everybody who comes into the hospital does a lateral flow test, which can still be ordered or picked up from pharmacies. And we also ask for you to wear a face mask. If you do have an exception for wearing a face mask, we ask you to bring in that certificate. And unfortunately at the moment, absolutely right Jane, we can't unfortunately have children within the unit due to the current COVID restrictions. Any more questions at the moment? No? So anybody that's just joining us, welcome. And if you do have any questions for this very experienced outpatients team, anything to do with the appointments during your pregnancy, any queries that you may have, we've got Kate here from the Fetal medicine team, Sue from our outpatients team, and Jane, the sister from our outpatients team. So really experienced team. If you have got any questions, then do please ask. And as if by magic, wonderful, we've got some questions. So we've got Rebecca asking, can I ask what to expect from the initial maternity outpatient consultant appointment? My first one is booked for 21 weeks and I haven't been under this care before. So Jane, I think that's probably great for you to answer.
So firstly, I would suggest that if you don't know why you've been referred, and we hear that a lot, that women don't always know why they've been referred. And that is something we're working closely with the community midwives to suggest that they actually have that discussion with you when they do refer you. Very often the reason for your referral is known to you, but you just haven't appreciated why. So the appointment that you receive at 21 weeks is usually so that we've actually had your anomaly scan. And the anomaly scan is an opportunity to not only date your pregnancy, but also obviously look at more detail at your baby's growth and development and continue on a routine pathway for outpatients care if appropriate. If not at that appointment, if when you've had your anomaly scan there was concerns over your scan, then you would be referred to a different team, and that would be the team where Kate is working, and she can advise on more about that. When you see the consultant, they would look at the reason for your referral, if you've had previous babies and what your deliveries were in the past, and any difficulties you may have had with previous deliveries, or if you have any medical conditions that they need to be aware of, any blood tests that you may have had recently that we need to look at the results for. And then they would use your blue notes, but also our computer system, to make a plan with you. And there should be no surprises written in your blue notes, because it would be a discussion taking place with you. And then they would make a plan with you for your ongoing care in pregnancy and the recommendations that they would have for you. We use guidelines, we use pathways, we use national guidelines and pathways to ensure that we're offering safe care for you and your baby in your pregnancy. Sometimes that means you don't need to come back. Other occasions, for the reason for referral, you may come back. You may come back every month, you may come back after your 36-week scan for a review of your pregnancy, how it's gone, and a plan for your birth. So it's very individual, but obviously it depends on the reason for your referral.
Thank you. Thanks, Jane. Hopefully, Rebecca, that does answer your question. I think ultimately, if you're unsure the reason for referral, do contact your community midwife. Maria has posted up that she's having a caesarean section tomorrow under general anaesthetic. And are there any tips for her husband while he waits for the baby and I to come out? He's a bit worried and feels out of place, especially being alone with the baby while she's still in the theatre. Oh, thank you, Maria. Jane again.
Well, I manage the caesarean section list, but I don't actually work on delivery suite currently. Kate, you may have worked there since I have, but all I would say is you won't be left on your own, firstly, and you will be well supported because there will be a member of staff that will support your partner and you through the process, and your partner wouldn't be just left with a baby on his own to care for. And he will be reunited with you as soon as it's physically practically possible once you've had the operation and transferred to the recovery area. So we would be supporting your husband and baby throughout that time as well. I don't think that's any different now to how it always has been.
Yeah, and I think it's important for your husband to get a good breakfast before he comes in. Like clearly you're going to be nil by mouth, but it's important that he has a good breakfast and a big mug of tea before he comes in. Just to make sure he doesn't and have his camera ready. Make sure he doesn't feel too wobbly at the time. But everybody will be there to support him. And good luck.
Enjoy.
Good luck. Charlotte has posted up, "Hi ladies, I hope you're all well. And if this is the Horton Hospital, I want to say a big thank you for all the support I got through my pregnancy at the very first lockdown. As I was worried about having a blood test, and the midwives were so supportive and were second to none. My daughter Alicia Jasmine will be 2 in May, and I'm so proud of her and how far she's come." So she wants to just thank everybody. So that's really lovely. So both Jane and Sue do work at both the Horton and the John Radcliffe, and maybe as part of the team that you've come across, Charlotte. But it's lovely to hear how well things are going for you now. That's great. So we're up to date with questions. So if you do have any questions, this is a perfect time to ask. We did start a little late today, but we are going to need to finish at 1 o'clock. So we're down to our last 10 minutes. So if you do have questions, pop those up on the screen and we will read them out. I'm just wondering if there was anything that we wanted to talk about at this time. I think it's important to say, always remember to bring your blue notes with you, or if you're from another hospital and visiting our FFMU team with other notes, please always bring your notes with you, which really helps for it to be a seamless consultation and ensure we get all the information we need.
Can I also add, if you move address or if you change your contact number, please let us know, because if we're sending out a letter of an appointment for you and you haven't received it, then obviously we then need to follow up on that with you. So it is important that you let us know if those details do change.
When your midwife refers you for a consultant appointment, if it is within the general antenatal clinic appointments, you may well be offered your appointments either at the John Radcliffe or at the Horton in Banbury, and this is done on postcode. But if we send you out an appointment for one hospital and it's easier for you to go to the other, just contact us and we can organise that appointment to be moved around. The majority of the fetal and maternal medicine appointments are actually based at the John Radcliffe. We do run a diabetes clinic at the Horton, so we can see you there. But the rest of the fetal medicine and the maternal medicine appointments are based here due to the specialist equipment that we use. If you do have concerns with travel costs and worries about getting here, speak initially to your community midwife to see whether there can be any support offered. Because we do understand sometimes for people in the north of the county it can be difficult to get here.
I would like to add, if you are coming to the hospital for an appointment, probably best to bring a bottle of water and some snacks, because sometimes the clinics, the HMBs, they do run over. So although there is a canteen on site, sometimes bring snacks and drinks just to keep you hydrated, because it does get quite warm in the hospitals.
That's a good point, really good point. So Maria, who spoke to us about having her caesarean tomorrow, has written that, "Thank you ladies, you're great." And she's been following since her 20-week scan, and everybody's been a fantastic support, answering all of the questions at the hospital and in this live channel. So I think from all of us, really good luck for tomorrow, Maria. Now, Faye has given some advice to Maria. A top tip for partners is to wear a zip or button-down top so that you can have some lovely skin-to-skin with baby while they wait to be reunited with you. And I think that's a lovely idea. Yeah, that's great. And Charlotte just thanked us for the response, and she's hoping for her second baby with us very soon. That's great. We do offer throughout all of the departments, we often take blood tests as part of our screening, and I think it's important to say that whenever a blood test is taken, we will always document that blood test is taken in your notes, and we will follow up the results. You may well be advised that we won't directly contact you with a normal result. We take a lot of blood tests every day, so don't be surprised if you don't hear from us directly, because it's probably pretty reassuring that everything's normal and you can have the test confirmed by your the results confirmed by your community midwife. If there are any concerns with the blood tests, or that we think that there might be something that needs following up, we will generally contact you within 24 hours. But that plan should be made with you when the test is taken. Okay. I think it's important to say about uniforms as well, because we all have different uniforms on here, and for anybody that's just joined us, we should all be wearing identification as well, in the form of an ID badge which will have our name and what role we also carry out within the hospital. Always ask to see somebody's identification if you're unsure, if somebody's wanting to give you or your baby care, and nobody ever minds to be asked for that. But I think if we run through the uniforms, Kate, explain your uniform.
So I'm a midwife, and I wear a royal blue colour with a white trim.
Okay, so I'm a maternity support worker, so we're in pale blue with a white banding blue trim.
That'll be the one.
So, and again, we always have ID badges on, and we should all be bare below the elbows as well. So if you see someone with a watch, tell them off.
What's sooner than later,
And I'm currently the clinic sister, so I'm wearing navy with a white trim, and you may see the ward sisters in the same uniform in maternity.
I'm the matron, and we wear the navy with the red trim. And if you see any of us around when you come on in, make sure you just say hello. So is there anything that anybody wanted to say about? Anything that you feel would be a really useful thing? We've covered a lot of the stuff already.
I think the one thing I would say about fetal medicine is that we get a lot of referrals from ultrasound both here and at Horton, and sometimes we actually don't need to see patients even when they've been referred to us. So we aim to process a referral that we've received within 48 hours, and we will always contact you to let you know the outcome of that referral, and to not be alarmed if it's the case that we don't need to see you. So sometimes a second opinion comes from our consultant after a sonographer's seen you, and it can be the case that actually they're very happy with your pregnancy and very happy with the well-being of your baby, and we don't need to see you here in our department, but that would be sort of documented and explained.
Yeah. And if you do think there has been any referrals to any of the outpatient services, and you haven't heard anything, then certainly get in contact with your community midwife or the person that referred you, and follow that up.
And from the antenatal clinic perspective, we often see you at 20 weeks, 22 weeks, and then the doctors at that point may decide that your care can be continued by your community midwife. But as the weeks progress, things may change, your circumstances may change, and there may be concern over your pregnancy or how you're feeling. So you may be referred back to the clinic to see one of the doctors again, and that's not anything to be alarmed at. That's quite routine for us to see you again if required.
actually. But a couple of other things. Leanne has said, when my baby was born last year, labour was very quick, and I didn't have any contractions until I got the urge to push. Is this a specific type of labour, and is this likely to happen again if I'm lucky enough to become pregnant again? Well, we're doing more of the antenatal talk today, and there is going to be opportunity to speak to the delivery suite midwives about labour issues. But I think it's a fair point, and we are midwives. So, Kate, did you want to speak about?
Yes. So sometimes it can be the case that sort of first experiences of labour can be replicated again with a second pregnancy, and I think it's something really important to bring a booking appointment with a community midwife. It's really important to feel that there's an awareness of that previous history and to really explore how things happened and those events as they unfolded with your first delivery. Once your community midwife has talked that through with you, she will probably be able to offer some advice to you for monitoring sort of labour signs and symptoms, how quickly to give us a call, and then how we go about making sure we care for you in the right way throughout the whole of your pregnancy to ensure you feel in control and informed and able to deal with that scenario should it happen again. And sometimes I think when patients have had a nice, quick, delivery uncomplicated, and they're medically well and their baby is well, sometimes their preference would be to maybe opt to have their second baby at home. Which is absolutely something that could be talked about with the community midwife with a booking appointment.
That's great. Thank you. And Pat has asked, do people find parking a problem at the JR? I think it's a bit notorious for parking up here. I think just as observation, since COVID, parking has become slightly less of a problem, although we know that we don't have enough parking on site here. I think the best thing to advise is that if you can use the park and ride, we would definitely suggest that you do that. But if you do need to drive in, is to allow plenty of time to find a parking space. And we are always understanding if people do turn up later for their appointments because they've had difficulty in parking, we do understand that, and you won't be sent away unless it's the clinic is finished, but it would be unusual for that to happen. So just don't ever panic, find your car parking space and make your way in as soon as you can. If you are in labour, there are some drop-off spots by the front doors on level 2, so you never need to worry about the parking there. But certainly since COVID it has been slightly improved. Thank you, Pat, for your question. Oh, we've got another question. So Jodie has asked us, thank you for doing this. She's had several referrals at fetal medicine, a growth scan, abnormal umbilical Doppler, all turned out well. And she's also under maternal medicine for pre-existing high blood pressure. This is a shame that it's not offered at the Horton, but she's very well looked after. And she's 30 weeks pregnant with DCDA twins, so twins. So that's fantastic. So she just wants to say thank you to everybody for looking after her. That's great. Well, I think, I'm sorry to say that we have come to the end of our session. I'm sorry that we were a little late in starting. As I said at the start, not exactly a technology whiz, but we got there in the end. And we would just we'd like to thank everybody for joining us, and I'd like to thank the team for being here as well. And the next Facebook Live session for Meet the Midwives is going to be in 2 weeks' time, but there are going to be the infant feeding team Facebook Live sessions continuing as normal. And thank you everybody for watching, and thank you for presenting.